Walking is man's best medicine. Walking stands out because it's equipment free and accessible anytime. Just lace up your shoes and start moving. Hi, I am VVS Lakshman and it is my pleasure to welcome Dr. Alankar, a celebrated expert in bone health who will share valuable insights on the importance and benefits of walking. Doctor, what are the long-term benefits of walking and how long should one walk?
Thank you, Mr. Lakshman. It is a great pleasure meeting you. Your question is, what are the health benefits of walking and how long should one walk? So my answer to this question is, walking is the best exercise. It is an excellent form of exercise. Anybody can do it irrespective of age, gender or physical condition. Even if you have some minor illnesses, you can continue to walk. It has been found that people who are regular walkers, they live longer on an average as compared to people who don't walk. Even if you have illnesses like knee pain or diabetes or blood pressure, you can continue to walk. It is very easy. You just hit the road. And there is no restriction. You don't need a lot of equipment. It is easily available form of exercise for all of us. For example, if you walk regularly, you will not have illnesses like diabetes or obesity or blood pressure or heart diseases. Even if you have all these conditions, walking is the best exercise for you. And the second part of your question is how long should one walk? I think walking for 20 to 30 minutes on an average for at least 2-3 days a week is a good form of exercise. But if you can walk more, if you enjoy walking, I would recommend to all my patients walk at least 45 minutes to 1 hour daily and you can enjoy walking all 7 days a week. Thank you.
Thank you, doctor. How does walking compare to other forms of exercise for overall bone health?
That is a very good question. So walking, like we discussed, is a very easy form of exercise. So there are some things which are really important here. So walking leads to loading of the bones of lower limb and it also loads the muscles. But then there is no impact loading. Impact loading, as we know, which happens in some other forms of exercises, can lead to degeneration of the cartilage. But walking has no impact loading, but it still loads the bone. So there is something called as Wolff's law, which says that new bone is formed along the lines of stress. So if you load your bones, your bone quality remains good. So walking does that. Walking is a really easily available form of exercises. It causes loading of the bones and it also causes increased blood flow to muscles. So walking protects you against diseases like osteoporosis and osteoarthritis and it also improves blood supply to your muscles and your joints. It also increases your neuromuscular coordination. So walking is good.
Thank you. Doctor, what are the misconceptions of walking for osteoarthritis patients?
Thank you, Mr. Lakshman, for asking me this question. This is a very important question. In fact, I was waiting for you to ask me this question. There are a lot of misconceptions among our people about association of walking and osteoarthritis. There is a wrong belief that walking will lead to either incident osteoarthritis or will lead to progression or exacerbation of osteoarthritis. Today, I would like to tell all of you that walking does not lead to osteoarthritis or progression of osteoarthritis. In fact, walking is the best preventive exercise against osteoarthritis. And I would say further, even if you have osteoarthritis, walking is the number one exercise that you can do to delay the progression of your disease. So walking is good. Second misconception that people have is by sitting cross-legged or by sitting on floor or by using Indian toilets, there will be incidence of osteoarthritis or there will be progression of osteoarthritis. This is wrong. There is no scientific evidence to prove that using Indian toilet or sitting in Indian toilet position or sitting cross-legged on the floor can cause osteoarthritis. In fact, by this typical Asian habits of sitting on the floor or sitting cross-legged, our patients who have advanced osteoarthritis also continue to have high range of movement in the knee. So this misconception that sitting cross-legged or using Indian toilet will lead to osteoarthritis is wrong. But then at the same time, I would like to advise that if there is any activity where you have pain, you should avoid that activity. This includes sitting cross-legged or using Indian toilet. Thank you.
Thank you, Dr. Alankar, for your valuable insights on the benefits of walking. As we all know, long walking sessions help boost endurance and enhance our fitness levels. Let's continue to spread awareness about the importance of walking and encourage the India Walks initiative.